What are the possible causes of breakthrough bleeding during pregnancy and how can it be treated?
Hello everyone. Today we're going to be discussing an important topic that can sometimes cause worry during pregnancy, which is breakthrough bleeding. We will be going through the possible causes, when to be concerned, and how it can be managed. It's crucial to remember that any bleeding during pregnancy should be reported to your healthcare provider.
What is breakthrough bleeding?
Breakthrough bleeding is any bleeding or spotting you might experience between periods or, in this case, during pregnancy. It's called breakthrough because it occurs when the body's hormonal cycle is out of sync, which causes you to bleed at unusual times. In the context of pregnancy, it's the bleeding that occurs outside of regular pregnancy milestones, like implantation.
What causes breakthrough bleeding during pregnancy?
There could be several reasons why you might be experiencing breakthrough bleeding during pregnancy. Implantation bleeding. This is a common cause early in pregnancy. As the fertilized egg attaches to the uterine lining, it can cause light spotting. This is typically lighter than a normal period and occurs shortly after conception. Sexual intercourse. Due to the increased blood supply in the cervix and vaginal walls during pregnancy, sexual intercourse can occasionally lead to light spotting. Infections. Any infections in the pelvic cavity or urinary tract can also cause breakthrough bleeding. Ectopic pregnancy. This is a serious condition where the fertilized egg implants outside the uterus, usually in the fallopian tube. It can cause vaginal bleeding and requires immediate medical attention. Miscarriage or threatened miscarriage. Vaginal bleeding can also be a sign of a miscarriage or a threatened miscarriage. It's essential to seek immediate medical attention if the bleeding is heavy or accompanied by pain or cramping. Placenta previa or placental abruption. These are serious conditions related to the placenta that can cause bleeding later in pregnancy. Both require immediate medical attention.
How is breakthrough bleeding treated?
The treatment of breakthrough bleeding during pregnancy largely depends on its cause. Most importantly, any episode of bleeding should be evaluated by a healthcare provider to determine the underlying cause and appropriate treatment. Observation. In the case of light spotting due to implantation or sexual intercourse, often no specific treatment is needed, and your healthcare provider may simply recommend observation. Antibiotics. If the cause is a urinary tract infection or another type of infection, antibiotics may be prescribed. Hospitalization or surgery. For more serious conditions such as ectopic pregnancy, placenta previa, or placental abruption, hospitalization or even surgery may be required. Remember, while breakthrough bleeding can be alarming, it does not always indicate a severe problem. The key is to communicate with your healthcare provider, so they can help determine the cause and appropriate treatment. We hope this information provides a helpful overview and reduces any worries you might have about breakthrough bleeding during pregnancy. Stay safe, and take care.